Hello and welcome to the Children and Young People's Diabetes QI podcast. The following recording is a conversation we had with a team at Warrington and Halton about how they have developed their transition service. The team has recently been involved in a transition QI collaborative in which they developed their transition service through applying QI methods, engaging with children and young people and gaining feedback from parents and carers. We'll speak to clinical lead Dr Satish Hulikere, Dr Ram, Claire, a transitional nurse specialist, and Jack, a young person who has been involved with the team in developing the transition service. Just to make you aware that as we record these podcasts remotely, technical difficulties are inevitable, and on this day we did experience difficulties in signal quality, which may have affected the quality of the recording. However, we have done our best to edit this and to make it as clear as possible. We'll do some introductions, starting with Satish.
I'm the clinical director here for Paediatric and Women's and Child Health Services, and I'm also the diabetes lead for children's services in the trust. I've been working as a diabetes lead for last 8 years and also the clinical director for Women's and Children's Services for the last 5 years. And I've been a consultant in this trust for the last 10 years. That's my introduction, and I'll pass on to Dr. Ram.
Hi, I'm Dr. Ram. I'm an international for pediatric diabetes and endocrine services, and I've been a part of the Warrington diabetes team for the last 2 years, and have very actively involved in adolescent and young patients with diabetes, and especially in this particular QI transition project.
Hi, my name is Claire. I'm quite new to this project. I work as a transition nurse specialist. I started in post in June 2020, and I'm really excited about the project.
Great, thank you. And finally, Jack.
Hello, my name is Jack, and I'm going to be interviewed by the Diabetic team, and they are going to go over the transition period.
Jack has been involved right from the transition. He's involved with the transition project, and he's been part of our 2 workshops, and he's been in the transition now and attending the transition clinic. So he's got first-hand information about the quality improvement project and also about his experience. He's going to share this with us later during the part of the podcast.
Great, thanks to all of you. And Jack, it'd be great to hear a little bit about your experience of the transition project also later on, so look forward to that. I wonder if, Satish, if you're able to just give an introduction about the service, just a little bit about the context, your patient population, your area and the kind of services that you provide.
Yeah, Warrington and Halton Hospital NHS Foundation Trust provides services for children and young people in the region. We have around 50,000 children in the area, and the Paediatric Children's Services basically looks after children from the age of 0 to 18 years in our trust. In regards to diabetes service, so we do have a weekly clinic in the Warrington Hospital and a monthly clinic for children and adolescents at neighboring Halton Hospital. So both hospitals are part of this Warrington and Halton Teaching Hospital NHS Foundation Trust. With regards to diabetes, we have a caseload of 133 patients, of which 126 are type 1 diabetes patients, 3 are type 2 diabetes patients, and 4 cases of cystic fibrosis related diabetes. Our team consists of consultants, 3 pediatric diabetes specialist nurses, 2 dietitians, and a dedicated diabetes clinical fellow. We have a clinical psychologist in the team, but currently that post is vacant, which is going out for advert in the near future. 20 young people transition every year into adult services. We do have a young person's diabetes team and the adult endocrinologist. We got 3 adult endocrinologists and 2 consultants are actively engaged with the transition clinics, and they do attend our joint transition clinics, which happens in children's outpatients department.
Okay, so just moving on to transition then as the subject. Why did you feel that transition was something that you would like to improve, and when was that?
Yeah, Transition is all about when a young person moves from one diabetes service to another, typically from pediatric services to adult services. Uh, the young people feel nervous, confused, and anxious regarding transition from pediatric to adult services. They do not want to leave the pediatric services, so it is important that the service we provide for transition should be tailored to meet the needs of the young people, and it's also important to make transition everyone's responsibility, to empower the young person and also to support the families. So that's why we identified transition as an important quality improvement project which we wanted to get involved. And it's about coordination with adult services to ensure the continuity of the care in a safe and timely manner. So this is very important for us, and transition is on the trust agenda for 2020-2021.
Mm. And prior to the improvements that you made, how did that look at the time, the transition process within your service? Was it was there any particular problems? What was the thing that kind of required improvement with that?
So every year, as I mentioned earlier, we have 20 young people transition into adult services at around the 17th birthday. This handover joint clinic is attended by the children's diabetes team and adult diabetes team, including consultants and the diabetes nurses. We do have the dietitian attending this joint transition handover clinic. We used to have a single joint handover clinic in the children's outpatient department, approximately about 3 clinics every year. So following this the handover joint clinic, the young persons are basically transferred over to the young persons team, and subsequently they're seen by the young persons diabetes team in the main adult outpatients. So the service did not have a lead diabetes nurse for transition, nor a transition nurse for supporting the young people for transition.
Okay, thank you. And I'm trying to just find out a little bit about your quality improvement projects, because I know you took part in a transition QI collaborative. How did you find out about that? And how did you work together as a team in getting these new interventions up and running?
So just to give some background, we had an opportunity of improving the healthcare transition collaborative. The improvement collaboratives are offered and delivered by NHSI to support the clinical practice improvement, but providing a structured program utilizing the quality improvement theory and methodology. In August 2019, there was an email communication regarding this collaborative project, and which the execs were very supportive for us to sign up. And there was an agreement between NHSI and the Warrington and Halton NHS Trust to work in partnership on an improvement program to deliver a collaborative on improving the healthcare transition. Basically, the aims of the collaborative are the improving the experience of all the young people and families when moving from children to adult services, providing an uninterrupted, coordinated approach to healthcare across the transition pathway and organization boundaries, and to drive the change within the organization to embrace and embed developmentally appropriate care, not only to understand but meeting the unique needs of the young people. The other aims were to achieve the best possible long-term health outcomes for young people with long-term conditions, and to effect the change and establish the best practice transition pathways, which are mainly cost-effective and safe and also sustainable. So we joined the project in August, and subsequently we had the session in September, which was a launch day for this of this quality improvement project, attended by not only our trust but also other trusts involved in the transition quality improvement project. So during this launch day, we got guidance and information about improving the healthcare transition collaborative, and we were informed of the 150-day collaborative project with a follow-up event in October, which was held in Birmingham. And finally, the review was done by Angela Horsley, head of the Children and Young People and Transition for NHSI and NHS England. So basically, during this launch day, we understood the model with aim, what we are trying to accomplish, and to measure how will we know that the changes in improvement and ideas result in improvement. So following this, we came back and reflected on this meeting with a brainstorming session in preparation for this program. We identified the following requirement for involving in the joint collaborative quality improvement project. Basically, we looked at the services in the trust which supports transition, as diabetes were leading in the trust for transition. So we took diabetes transition as the initial project, later to plan later to move on to the other transition in epilepsy and respiratory services.
Okay, brilliant. And before we go into any more detail about how you found out whether the change was an improvement and things like that, I just wanted to get an idea of the different roles that you have in your team there as well. And Claire, I wanted to speak to you about your role as transition nurse, if that's okay, and what that involves.
Yeah, so as I said, I'm quite new to the team, and my role was developed on the back of the Quality Improvement Initiative. Very new in post, currently working 15 hours per week as a transition nurse specialist, so completely separate from sort of the other specialist nurses, but working collaboratively with them. And this is a secondment for 12 months at the moment. So my background is I've worked with a registered children's nurse, and I've worked for the trust intermittently for the past 15 years. This role really spoke to me because I'm really passionate about service improvement and improving outcomes for our young people. So yeah, the first thing I wanted to look at really was what was current and what we were doing within transition, what transition currently looked like for our young people, and what improvements we could look to make. Obviously, we've got quite a large cohort, so initially looking to take a small cohort of patients and try and work with them and develop the service.
Okay, so you started with quite a small idea to begin with, a small cohort of patients.
Yeah, and I think for me, I'm looking to engage with young people from about 14 years of age.
Yeah.
Just to promote the early planning, preempting care, so that we as an organisation can meet the needs of our young people.
Okay, and that's from the age of 14. And what would you say was the upper age limit then, if you're looking at the transition age group?
Yeah, so I would engage with young people from 14 all the way through to after the transition, really. So my role would very much be part of engaging with young people, even in the young person services after the transition, to ensure that we're still advocating for these young people, and ensuring that the continuing teams have everything that they need and all the information that they require. And hopefully this approach will aid that seamless transition that we're all striving for.
Brilliant. And one of the barriers quite often that we find in transition like this is is being able to engage with the adult team as well. And I just wondered how you managed to build a relationship with the adult team to kind of ensure that successful transition.
Absolutely. So with any new role, there are always challenges. I've got a very positive personality, so for me, engaging with the adult services straight off was really important, and trying to develop those professional working relationships. Obviously, it's about, for me, gaining their sort of an understanding of their workload and how we can sort of fit in, and how my role can help with transition to make it easier for the continuing care team as well as our young people. And obviously other challenges are sort of around engagement really from young people, and it's how we sort of I have engaged with our regional advisor, who mentioned a course called motivational interviewing, which was really resonated with me really, and how we speak to young people. I was really fortunate enough to go on that training course, and all the participants worked with young people and transitioning to adult services in some capacity. It was really informative, and it's changed the way I speak with young people moving forward.
Thank you, and we'll bring that your role back into this. I'd like to hear from all of you, and just in this kind of introduction to service here. And Jack, I wonder if I could bring you in to talk about how you found this and your involvement in the transition service.
Well, before the project, I didn't know what to do. I was scared and vulnerable to what's out there. I didn't know what to expect when I was a diabetic. There was tons of responsibilities on my hand, and I just didn't know what to do, by ordering prescriptions to going out, funding myself privately with no guidance of parents. But after the transition period, I feel a lot better, and I feel like I'm more prepared for the future.
And I was wondering what your view was on this, and I'm just thinking about other diabetes services who might be struggling a little bit with their transition, and with young people going into adult services who are perhaps not ready. And I wonder what you think services should have in place, in your opinion, in making that as easy a journey as possible.
Well, they obviously have an advice centre. I'd like to go there, and that'll help me guide my future and help me to become who I am today.
I wanted to ask about giving feedback, because certainly when I'm working with services, we ask services to engage with their patients and get feedback from patients really, and young people about how you think those changes are happening and how well the service is working. And I just wonder, are you able to give feedback to your team?
Yeah, so feedback is it's an important matter, because it really conveys the message that I can do well, and if I do have any criticisms about what they want that they do, I can easily come to them, and then they'll improve off that.
Okay, so you feel that can be acted upon if you have any concerns about that. Okay, cool. Thank you, Anna. I'll try and bring you in at the other points within the podcast as well. But I know I've not spoken fully to Dr. Rab yet. I just wonder if I could bring Dr. Rab just to talk about your role and involvement in transition as well, and the role you played in kind of guiding it to where it is now.
So I've been working with the diabetes team for the last 2 years here. Initially, as Dr. Satish mentioned, that we probably had one transition clinic when they turn around 17. And we could obviously see the apprehension and the anxiety with not just the patients but also with parents, because most of our children's services they are kind of well taken care of, and parents are involved in getting their prescriptions done, and we depend on parents for getting information history. But then one thing what I noticed with the young person is the apprehension about attending clinics alone in future, about taking their own decisions about getting their prescriptions done. So that's where we identified with this opportunity to take up this project that it's important to probably do a project for their emotional well-being, for them able to cope with it rather than looking at numbers or statistics or their outcomes really, because only when this has been addressed is when we can meet the rest of the the criteria for their better management. With this, I think the team came together with taking up this 150-day project, where we started off with a questionnaire. Dr. Satish, do you want to talk about it?
We did the transition readiness questionnaire. So we included all the type 1 diabetes patients over 16 years of age. We have 27 patients over 16 years of age. So we conducted a transition readiness questionnaire about their diabetes management. So this survey was distributed to all the patients and the families when they attended the clinic. The survey was also sent out by email. The survey included the 5 domains regarding the number 1, outpatients appointment, number 2, managing diet and medication, number 3, managing illness, number 4, lifestyle and exercise, number 5, talking with providers. So all these 5 domains are important for transition, and which helps the young adolescent to gain some confidence. So we wanted to identify what are the areas with low confidence. The survey had a confidence scoring from very high confidence to very low confidence. So when we analyzed this survey from the feedbacks what we got out of those 27 patients, but key thing was the survey feedback was not received from all the 27 patients, but whatever the survey feedback we received, we could identify some themes around. So among the 5 domains, the majority of the adolescents had low confidence when it comes to lifestyle and exercise. Number 2, managing diet and managing exercise and diabetes. Number 3, about as Jack mentioned, about outpatient appointments, in particular with ordering repeat prescription and also attending clinic on their own. So by getting the survey feedback, we identified that we need to do something about this. So we did 2 workshops to address these sort of feedbacks and to improve the confidence level from low confidence to slightly higher confidence. So the the workshops were, the first workshop was conducted in a nearby leisure center in October half term last year. So this session was facilitated by the young persons team and also the children's diabetes team. The head of the patient experience for the trust attended this event and also took feedback following one-to-one discussion with the young persons and their families. So during this workshop, we had sessions on giving a national picture about transition, why it is important, and also we had relevant sessions on training the young person for relevant lifestyle, drugs, alcohol and sex. This was mainly facilitated by the adult diabetes nurse. And also we had we gave opportunity for all the young person and their families to meet one-to-one with all the different team members, both from the adult diabetes team and also the pediatric diabetes team, to discuss discuss any of their anxieties or questions around transition. So their outpatient experience identified the themes following one-to-one engagement. Basically, we got themes from the head of the patient experience, which was collected. Mainly, the themes were the young persons were feared, scared and nervous about transition, and also they were feeling too young to be leaving the children's services, and there was general fears about alcohol, parties, boyfriend girlfriend issues there, and there were some practical queries about driving and paying for prescriptions. So we address all these in one-to-one session and also during the initial session on by the adult diabetes team and also the children's diabetes services. So the second session was held in beginning of March, but to address the second issue, which was identified as a low confidence, which is around the diet and exercise and carbohydrate counting. So we had a session from our experienced dietitian who basically provided a session on doing a carb counting and also managing the diet, especially when they go out socializing with their friends. So the young person and their families who attended this session, we had greater engagement, and this was done in a hospital setting on one of the weekends, and we had greater engagement from the families and also the young people who attended this session. Jack, who is with us now, also attended both the sessions and found it very useful. So the feedbacks were taken from the families, again identifying that to look for their confidence level again. So by doing these 2 sessions, we have increased the confidence level, as Jack mentioned earlier, from what they were before. So they significantly increasing their confidence from before the quality improvement project. So we found this quality improvement project very useful for our patients and the families, supporting or increasing their confidence levels.
Okay, that was going to be one of my questions actually. How did you know that the improvements were being made, and what kind of feedback were you able to get from that? And it sounds to me, from what I can hear, that you're able to use the same surveys in order to collect that data kind of before and after the workshops took place. Am I right?
Yeah, what we've done is, the outcomes from this, both the quality improvement project and the workshop were, one is raising the awareness and reducing the anxiety for the young people and their families. But also we have made some improvements and positive outcomes from the quality improvement projects, like as Dr. Ram mentioned about increasing our transition clinics from 3 per year to almost 6 per year. So joint handover and transition clinic. Number 2 is it's about gradual transition compared to what we used to do in the past as single transition clinic. So like Jack is in an advantageous position where is going through this quality improvement project and is having a gradual transition compared to the adolescent who were transferred last year and the year before. We introduced Claire. Claire has been phenomenal in here. Claire comes as a transition nurse, which was identified one of the things to reduce their anxiety during the transition, also post-transition. Claire's appointment is one of the key things for us. She attends the joint handover clinic, transition clinic, plus also, as she mentioned, that she gets involved from adolescents from 14 onwards. But not only that, but also she is continuing to engage with the families in between clinics and having one-to-one dialogues and discussion around and any areas which needed addressing. She's going to sort this out before and after clinic. And also she attends the clinic after transition and with the adult team as well, which is very important for the young persons being transitioned.
And we also made sure that there is an individual transition pathway based on the feedback that's provided by the patient, so that we didn't want to generalize it. So we wanted to look at individual aspects of what their confidence was less and probably work on that. So as team members, the specialist nurses, Claire, and the clinicians together, we kind of agreed on the pathway for this particular patient, and all of these agreed points were kind of worked upon in between the two clinics. And when they came back for the second clinic, we all looked into it and reflected whether we had met the requirements, whether the patient was ready or not, whether there was even more need of a structured education for the patient. So that was the highlight of the major outcome what we've had of having a gradual transition. The added on thing is we've also had the transition consultant, not just to look into diabetes, but also the other services like respiratory and epilepsy. And Ayakla is a brand 7 nurse, and she has started focusing on small groups with complex specialties patients to help them get over to the next to the adult team. One more thing we've got is we've had agreed funding from the CCG and the Warrington Borough, the Northwest Borough, to get a psychologist to work with the transition team. So because of COVID, I think it's not been in place. Adverts have not gone out, so probably we're expecting a psychologist to work in close with these particular patients.
I was just thinking that how this has developed so far, and particularly what's been going on in the last few months, and how is this developing as you're moving forward, particularly with the lockdown and things like that? Is that something that you've had to adapt to?
I think even though COVID caused many issues in NHS, but what we have done is we continue to engage with the families doing the virtual clinic. So we have maintained continuity with the patients and provided support for all the families through doing virtual clinics and also doing the video clinics using Attend Anywhere software. The trust has actively supported the teams to really embrace the virtual clinic, and we in diabetes service are at the forefront doing this virtual clinics. So we also conducted a virtual transition clinic. The young person's diabetes consultant did attend the transition clinic, and we did a virtual transition clinic as well. So COVID has not stopped us going forward with this young person's transition and also supporting the young persons and their families.
Brilliant. And I've just got the last couple of questions to ask, really, because we're going up to 40 minutes and just before we round off. And that's about quite often we're doing quality improvement projects like this, especially if it's really just in processes, which you are doing. And that's about leadership. And who's led on this project altogether? Would that be yourself, Satish, or?
Yeah, I think the key thing is about the trust were very supportive. Our chief nurse, Kimberly, was very supportive to take up this project and deliver this quality improvement project. So we had fantastic support from the execs and also the entire clinical team here. So even though I led this, but it was a team's involvement and the team's approach, exec support helped us to provide a good quality improvement project and also to develop our transition services going forward. So the QI program has equipped not only me and my team the new skills and knowledge about quality improvement, it has provided the access to range of tools and methodology to drive changes within the organization, improving the quality of care we provide and enhancing the experience of all the young people and families. So we learned as a team a lot of getting involved in the quality improvement project, and the team has developed, team has evolved, so team has benefited. I'm glad that we got involved, even though it's my leadership. I think this a team's commitment and dedication helped us to support the young families and the adolescents. Yeah.
Okay, brilliant. And one of these wouldn't be complete without talking about any barriers that you came across during your journey. Was there many in particular, and how did you overcome those?
A couple of things I want to mention about barriers and challenges is around, as we discussed earlier, engagement with young persons is the key thing here. I think it's important the way we communicate, how we interact with the young persons is what is important. So initially when we started with the first workshop and sent out the surveys, we did have little engagement. So this we learned lessons from that, and then we reached out to the young persons and their families, and we had a better engagement second time. So the key bit is about how we continue to basically continue and also encourage the young persons will help in going forward. So that's one of the barriers and challenges we come across. The second one is it happens in all the other trusts and nationally as well. It is the engagement from the adult team, not because they don't like transition, but because of lack of capacity. So we identified this as a problem. I think most trusts do have this problem, lack of capacity in adults. They look at as transition and young person as a small area in their workload. So what we've done as a team here is we have communicated through the appropriate trust meetings, raising our profile, and we have developed a transition newsletter about what we are doing with this project, and also to raise awareness among the trust. So we have also communicated through the social media about this quality improvement project using Twitter, and also we have actively been presenting our reports about our progress in the trust meetings, and we have also put this as an agenda and the standard agenda item in the departmental governance meetings.
Brilliant. Now, I think that's given us a really good overview of your project. It all sounds really positive. And I just wondered if I could go around everybody individually, just one final point. And the question is, do you have any recommendations, advice, tips for services wishing to improve their transition processes? And it's just what's kind of important in your opinion. It's just one point from each of you, really.
I think the biggest challenge we face is communicating and involving the young person to actively participate in clinic, or to come up with their problems, or to kind of talk to us freely about their difficulties or any sort of troubles they face in managing their diabetes or going into the adult team. So it's important that we identify the children who could be difficult later on
on during transition time period, earlier probably when they go into 15 years, and start getting them involved into the team. And whenever they come to clinic, probably not just focus on diabetes alone and take a whole their entire life perspective into the clinic to ask about their academics, how has their life been, and probably to involve them with the psychologist, to the transition nurse earlier on, introduce them to the team so that they can involve better. So once they're comfortable with this, then they can come up with all their queries they have about things they don't want to discuss with us about, like traveling, sex, drugs, alcohol. They've known to the team for so many years, so probably they're not comfortable discussing these things, and these are the queries which kind of remain in their minds and they don't want to open up to anybody. So we want to introduce them to the transition team earlier, and that can help us bring a better outcome.
Okay, so much to do with the focus on the patient experience. And Claire?
Yeah, it's I echo really what Neethi says, but it's about recognition. When young people are having difficulties, if we can get in there early on and maybe signpost them to supportive services. Obviously, if we know these young people, and some may feel comfortable talking to us, others may not, but if we allow them, if we can signpost them to supportive services before this starts to impact their diabetes, then I think that can only be of help. And it's about getting the message out really to everyone that this is a great period of biopsychosocial change for these young people, and we have to make reasonable adjustments when we are talking to young people and be mindful of this. And we have to have those difficult conversations in regards to drugs and alcohol and mental health and relationships. But if we can get in there early and preempt what might come, so yeah, and developing patient goals really, their own goals, let them take ownership of their own care and empower them to lead on it really. And one of the first few things that I like to do is ensure that young people, when they do come to clinic, ensure that they make a list of questions that they want to ask. And it just it's like the first little step really into transitional care, and looking at ordering their own prescriptions, going to pick them up from the pharmacy, even just those things that the parents may have always done, which is perfectly fine, but they should have an awareness of what they might need to do. So I think it's definitely about empowering and letting these young people take ownership and trying to preempt what might come.
Thank you. And either Satish or Jack?
Yeah, just to conclude, the biggest lesson what we learned is when evolving this quality improvement project is about small quality improvement project have the potential to implement an effective change. So it's important, however small it is, it brings an effective change. And we could see that the difference what we have made with the young people within the diabetes services, I think we need to evolve further into other services going forward. That's all I would like to say. And thank you to the NHSI for getting involved with this project, and thank you to our execs team who have been very supportive right from the start for getting this involved, and the trust has taken transition as an agenda for 2020-2021.
So that's great to hear. And Jack, I just wanted to finish with a final point. Any recommendations or tips for services wishing to improve transition processes?
I'd say support appropriate communication helps, giving a long way to improve experience and outcomes. It really does just emphasise that, and it just gives me the clear ideas of what to do.
That's great. Thank you again to the Warrington and Halton team for agreeing to talk to us about their QI project today. We covered such a lot in that conversation, in particular what's helped the team in developing their transition service, such as effective communication with young people, getting regular feedback, good teamwork, and how important it is to have support from senior leaders within the trust. To our listeners, has your service developed its transition process through quality improvement methods? If so, we'd very much like to hear from you. please get in contact with us at diabetes.quality@rcpch.ac.uk.